The coronavirus knows no geographic boundaries, and in Nebraska, rural communities are being hit hard. With limited infectious diseases and critical care specialists and limited ICU capabilities, these smaller hospitals in rural regions of the state are starting to reach capacity. Phil Bergman has more.
Across the country, rural communities are seeing the tolls of COVID-19 firsthand. Here in Nebraska, virus hotbeds are popping up in rural pockets of the state. 3 of the 4 counties with the most confirmed cases are in the central part of the state, including Hall County, which has more than 530 confirmed cases.
But when you really break it down by county here, it's a completely different picture that emerges, and it's alarming.
Dr. Angela Hewlett is the medical director of the Nebraska Biocontainment Unit. She says one reason these counties are being hit hard is that they tend to be home to food processing and meat packing industries whose jobs are considered essential during the pandemic.
These places are not places where typically people can work from home. And so they don't have the ability to telecommute and to work. They need to actually go to work.
You might think that those communities have been relatively spared from this disease, but they haven't.
Dr. Andrew Pavia is at the University of Utah. He says while some rural counties are showing few confirmed cases, we should take these numbers with a grain of salt.
Does that mean there's no disease? Absolutely not. It means that we don't have a good spotlight on what's going on in those communities. And so we're missing things.
Here in Nebraska, Dr. Hewlett says smaller hospitals with limited ICU capabilities are starting to become full in some cases and are needing to transfer patients to larger hospitals to get appropriate care. She says Nebraska is not out of the rough yet.
We have not reached our peak in any way here. We're not sure what week we are on yet, but we definitely have not reached our peak.
Dr. Hewlett expects more rural hotspots across the U.S. over the coming weeks. Reporting in Omaha, Phil Bergman, 3 News Now.
Dr. Hewlett says rural hospitals don't have enough staffing currently. She believes enhancing testing capabilities to be able to do large amounts of contact tracing would be huge for these communities.